because as long as we think we're an us, then we feel like we need to band together. And when we have someone saying, yes, let's band together and I will lead, I understand that we need what we need and I will lead us to it, well, then naturally we tend to follow them. Or I don't know naturally, but some people do. But in reality, this stuff is not, that's not what's going on in the world. And that's not what's actually happening. Most people who come here, as I've said, I don't know how many times before, are coming here because they want to work and make money. And they've identified this as a good place to do that compared to where they're living now. There are people who live in places that are very violent and have a lot of problems, and they're coming here because they see this as a place of peace and security. Some people just see it as a place of opportunity. They're doing okay where they are, but they think they could do better here. There's any number of reasons. Maybe they like our culture. Maybe they like the lifestyle that they see depicted. There are any number of possible reasons, but they almost all of them revolve around or are underpinned by a sense of optimism and hopefulness. So they're coming here because they hope that they can do something here that they are unable to do where they're at currently. Now, those are, by and large, people who think that way, who feel that way. Those are good people that you want around. Those are people you want to hire to work for you. They're people you want to be your neighbors because they're moving forward. They're looking for something better. That's not to say that everybody that comes here is a great person or that is going to fulfill the promise of their hopes and dreams that they had when they headed here. I'm sure there are all sorts of awful people mixed in, as there are awful people everywhere. It's hard to, I don't like that term really, but there are people who are generally good-hearted and generous, and there are people who are cynical and unpleasant, and there are representatives of these different sorts in every group of people you find anywhere. So it's not only immigrants, it's not only those people, whoever those people are to you, there are people in every social, cultural, ethnic group who are good, by generally considered good people, generally considered bad people, in between people who are sometimes good and sometimes bad, and everything in between. So I'm not sitting here pretending that all immigrants are great people, but of the immigrants I know, I'll put it that way, the people that I know or that I see, they are more likely to be motivated, hopeful, optimistic, and hardworking than otherwise, because it's a lot of work to come here. It's not something you just do. You're not just sitting there one day on your porch and you go, you know what, I'm sick of this crap. I'm going to go to America and live off of welfare and get free stuff, because I hear that they've got lots of free stuff there. So I'm just going to, Beverly Hillbilly style, just pack up the car and stack the family on top and then just drive over the border and there you are. It doesn't work like that. It's often dangerous. It is always kind of frightening and daunting to pack up and move to a new place. It's not an easy thing to do. So it's generally not done by people who aren't willing to lay a lot on the line to make it work. Okay, I guess that may be the way to put it. People who are willing to bet it all in order to get to something better. People who are willing to take a big chance, to take risks, to really extend themselves. Those are the people who are coming here. Those are the people who are generally making that trip and getting themselves settled here. So you would think, out of people who have that kind of courage and fearlessness and energy and optimism, you're going to end up with more of those people that are good people, people that you would want to work for or work with, and get to know. It just stands to reason. It's logical, if nothing else. It's a logical assumption that with those attributes being kind of baked into the process of going to another country and starting over again, you're going to get more people that are real go-getters and who are really have a lot of positive attributes than you will people who are lazy and shiftless and just looking for an easy way to get what they want. So just by its very nature, I think we can explode a lot of these myths, or at least dial them back a great deal by just looking at who makes that kind of trip and why. So I think it's important to do, and that's why I do it on this show a lot. Excuse me. I never remember to bring water here, and I always end up being very hoarse. So let me read some more stuff. I think I've made that point over and over again, and it's time for a different point. So here's a downside right here. When immigration status is used as a weapon for domestic abuse, it's not a bed of roses for everybody here. Okay, so this is from Fusion. I don't know what Fusion is. A quote. It begins with a quote. "Avoid the kitchen where there are knives," says Regina Wilcox, the sexual assault program coordinator at the Family Crisis Center of the Big Bend. "A lot of people will run into the bathroom and lock themselves in there, but they're cornered in the bathroom." These are some of the survival tips that Wilcox and other staff at the Crisis Center offer victims of domestic violence, sexual assault, and other violent crimes. The center, which was opened in 1982, is a community center in the small Texas town of Alpine, has since expanded its services to 3 separate outposts that provide a much-needed resource in the vast expanse of far west Texas. It's a region that includes the U.S.-Mexico border, where domestic violence can take on a new and awful dimension, one where victims can become trapped in abusive relationships due to their undocumented status in the United States. When Rosa, a 32-year-old Mexican woman, moved to Presidio, Texas, population 6,000, in 2011, she said her boyfriend began to use her undocumented immigration status as a form of social control. With no friends or family to turn to in the United States, she sees gaining legal residency as her only way out. "He knew that I didn't have any documents and that I didn't have any family here," Rosa, whose name has been changed to protect her identity, told me in Spanish. "He knew that I couldn't go back to Mexico, so I had to do all the things he said. He said that I belonged to him." Now Rosa feels trapped. "I cut his hair, I cut his nails, I shave him, I clean his ears," she said. "I need to be available when he wants to have sex with me at any time. I have to wear certain clothes that he wants, and sometimes when I say that he's hurting me, he doesn't care. He doesn't stop." According to Presidio Police Chief Marco Baiza, this type of abuse is not uncommon in the border region. "One thing that I see all the time in cases where one of the spouses is undocumented, they'll often get threatened by the abuser that they'll get deported," Baiza said. Or the abuser will say, "If you call law enforcement, I'm going to call immigration, and they'll send you back." The police chief added, And when there's children involved, it makes it worse. Usually the kids are U.S. citizens, so the abuser will go as far as to say, if you call law enforcement, you'll get deported and the kids will stay here. You'll never see your kids. Stuff like that. He says victims in that type of abusive relationship are sometimes also less inclined to call the police out of fear that it will lead to deportation. Baisa said that the number of domestic abuse cases he sees yearly has dropped significantly since he took his post in the early 2000s, a fact that he attributes to the unanticipated consequences of Texas' zero-tolerance policy toward domestic abuse. Under that policy, a police officer must make an arrest if there is any probable cause that abuse has occurred. As a result, spouses who fear that an arrest might lead to immigration problems are less inclined to call the cops. For the advocates of the Family Crisis Center of the Big Bend, helping victims of violence on the border means targeting the source of abuse itself. One of the most significant services they provide their clients is legal aid to acquire residency, which isn't always an easy feat under the current system. The center did, however, manage to help Rosa apply for legal residency through the Violence Against Women Act, a 1994 law that allows immigrant victims of domestic abuse to obtain immigration relief. Rosa has been able to file for an immigrant visa petition and has since been granted a work permit. But the wait for residency can take 6 years. It can take years. 6 of the Family Crisis Center's clients are in the process of applying for residency, while one other woman was recently granted residency after 4 years of waiting. For now, Rosa is waiting, working odd jobs and saving money for the future. She hopes that once she gets residency, she'll eventually be able to emancipate herself and her children from the abusive relationship. So, far from being the perpetrators of violence here, these undocumented persons are in fact victims of violence because of their undocumented status. So that's something to think about when you think of the humanity here and of the people who are in these situations. Moving on. We're actually about 3/4 of the way through with our show here. You have been listening to CU Immigration here on WRFU-LP Urbana 104.5 FM. Trying to think what to read next. Well, let's have something optimistic after that depressing thing. Excuse me. This is from NBC News, entitled New York Rule Changes Would Allow DACA Recipients to Become Nurses and Teachers. Hina Navid has almost realized her dream. The 25-year-old who came to the United States from Pakistan in 2001 graduated from the College of Staten Island with an associate's degree in January, passed her nursing exam in April, and applied for a license to practice in New York State. I would love to work in the emergency room, Naveen told NBC News. I feel that's where my passion is. But there was a hitch. State rules currently prohibit the issuing of 53 professional licenses, including those for nursing and teaching, to applicants with deferred action for childhood arrivals, or DACA status, a program approved by President Barack Obama in 2012 that temporarily removes the threat of deportation for undocumented immigrants, children, and also grants them authorization to work. Navid was approved for DACA in 2013. On Tuesday, 2 amendments to open these licenses to New York's 36,072 DACA recipients are expected to be taken up by the State Board of Regents. If adopted, they would go into effect on June 1st. Among those urging approval are the Mayor's Office of Immigrant Affairs and 4 other city agencies, including the Health and Education Departments, which sent a letter to the board in April during the amendment's comment period. Discussions on the amendments come almost a year after New York Appeals Court approved DACA recipient Cesar Vargas's application to the state bar. Excuse me. Sonia Lin, General Counsel and Policy Director at the Mayor's Office of Immigrant Affairs, told NBC News that allowing DACA recipients to become licensed would expand the number and diversity of people in professions like healthcare and education, as well as increase economic opportunities for New Yorkers otherwise eligible and qualified to work in these areas. We see the potential of this proposal to really support and enhance our city's economic vitality, she said. While it's hard to say how many New York City immigrants may benefit from the proposed rule change, a spokesperson for the Mayor's Office of Immigrant Affairs told NBC News there are roughly 18,000 city residents who are DACA recipients and have completed some college, according to estimates by the New York Center for Economic Opportunity. For Naveed and her family, a brain disorder occurring in less than 1% of the population was what brought them to the United States and what stoked Naveed's interest in nursing. Naveed was 12 when she arrived, and her older sister Aliza was seeking treatment for an arteriovenous malformation, a condition in which blood vessels tangle, causing seizures and strokes. They had entered on a visa, but while in the U.S., their renewal application was denied, their visa expired, and they fell out of status, she said. My parents were faced with the option of leaving, as we were required to, or staying because my sister's medical condition at that moment was at a critical point, Naveed said. Her doctors had strongly advised my parents against leaving. So they stayed. It was a difficult choice, but I think it's the same choice any parent would have made to choose to stay and fight for the child they came here for. One of 5 children, Naveed said being undocumented felt as if her life was on hold. She could continue attending college for as long as she wanted, but she couldn't apply for a job or a driver's license, she said. Naveed's older brother was the first to apply for DACA when it became available in 2012, paving the way for her and her siblings to do the same. DACA requirements include being under the age of 31 as of 2012, coming to the U.S. before the age of 16, and living continuously in the country since 2007. Naveed has reviewed her DACA status twice, she said. Naveed, who has worked for the Mayor's Office of Immigrant Affairs for a little more than a year on immigrant outreach, said that although she initially majored in pre-med and wanted to become a doctor, licensing requirements led her down the nursing path instead. The level of care and compassion her sister Alisa received from nurses and doctors while undergoing treatment solidified her passion to enter the healthcare field. While licenses regulated by the Board of Regents are open to citizens, permanent residents, asylees, refugees, and certain others with lawful status, deferred action recipients were excluded until the board voted in February to add them. That decision drew criticism from some Republicans. No doubt. New York State Assemblywoman Nicole Malliotakis, a Republican who represents part of Brooklyn and Staten Island, the borough where Naveed lives, told the Staten Island Advance in February that the board shouldn't be changing such regulations without debate and a vote in the state legislature. The lack of urgency from Washington to reform and enforce immigration laws are leading to policies like this all over the country, she said. A similar law went into effect in California in 2014, allowing licenses in fields like nursing and medicine to be granted regardless of immigration or citizenship status. Up until this month, Naveed's licensing application had still been pending, but just last week, Naveed received some good news ahead of the Board of Regents meeting Monday on whether to adopt the DACA amendments. Her nursing license had been granted. I've always loved the healthcare field, even though I had heard I couldn't go into medicine due to my status. I was able to find my passion in nursing, said Naveed, who will receive her bachelor's in nursing next May. I am really excited about finally being able to give back to my community as a nurse. So that's good My throat just isn't up to this endless talking. And I apologize for all the coughing and other interrupting throat clearing and whatnot that I do. But man, it's hard on the old vocal cords, which are already trashed. Anyway, so yeah, that's good. And here we have the story of a person who came here. We have the story of why they came here. This was not a gang member or a drug mule or something like that sneaking over the border, looking to expand their territory and terrorize our citizens. This was a family that came here for their daughter. For her health issues. They stayed because of her health issues. And we have this young girl who pretty much had no choice. She just came here along with her family. She's here now. She wants to do good things and help people. And our laws were making that difficult for her to do. So thankfully someone has loosened the requirements a little bit and made it possible for her to do something good. And I am very glad for everyone involved that they did that. And for her, I hope she has a good future ahead of her in the medical field, wherever she ends up. Okay, I think we probably have time for one more story here before the show is over. I don't know. This is Center for Immigration Studies. I'm not sure. Okay. Center for Immigration Studies. Actually, I don't think I'm going to read this. Center for Immigration Studies is kind of a right-wingish site. I was intrigued by the title, but I have a feeling they're going to put a spin on this that I don't agree with. And rather than try to edit it as I go, I'm going to just find something else. I am not required. I am not a news person. I'm not required to give time to contrary points of view. I will comment on them. I will describe them. And if I think they have merit, I'll support them. But I'm not just, I don't have to do it. So I'm not going to. Plain and simple. I am not a newscaster. I don't have to pretend to be, to give both sides as if every story only has two sides to it, which is nonsense. Some stories have one side and then a bunch of misinformation. Some stories have 100 different sides, and they're finding your two sides would be next to impossible because there are as many sides as there are people involved in the story. So, I don't agree with that stuff anyway. But I particularly don't agree with it on this show, where I get to decide what I talk about and what I don't. All right. Here we go. More positive news here. More ways people are messing with the system to make it work better. This is entitled, California Undocumented Immigrant Kids Gain State-Funded Health Care. Well, good. Children and teens brought illegally to the United States gained access to publicly funded health care Monday as California began allowing young people to sign up for the state's health care program for the poor without regard to their immigration status. State officials expect as many as 185,000 children under the age of 19 to join Medi-Cal in the first year, about three-quarters of the estimated 250,000 eligible youth. About 121,000 will be automatically transferred from a limited version of the program that provides only emergency care, giving them the full range of medical, dental, vision, and mental health coverage available for little or no cost with full scope coverage. In a rally outside the state capitol, healthcare and immigrant rights advocates celebrating the expansion turned their attention to their next goals. They want Medi-Cal, the state's version of Medicaid, to cover income-eligible adults who migrated illegally and are pushing to allow those who make too much money to buy private coverage to the state's insurance exchange, Covered California. While Congress remains gridlocked with stereotypes and hateful rhetoric, we were talking about that a little bit earlier, California remains as a hopeful beacon that tells people, immigrants, you matter. Immigrants, you contribute to our economy. Immigrants, you are people that deserve to have health care, said Senator Ricardo Lara from Bell Gardens, who wrote the legislation authorizing the expanded coverage. Critics question why California lawmakers are spending time and money to help people who immigrated illegally when there are American citizens in need. I don't see any people stepping up to help the American citizens in need. Anyway, here, classic. This acts as a magnet to the world. Bring your children, bring your families to California illegally, and you will get free health care. Here we have the let's paint immigrants as people who are coming here to get free stuff. This is from the executive director of the activist group We the People Rising. Bah humbug. Are there no prisons? Are there no workhouses? In his revised budget proposal published last week, Democratic Governor Jerry Brown included $188.2 million to cover the children and teens expected to get full-scope Medi-Cal coverage. While the federal government pays about half the cost of providing Medi-Cal benefits to citizens and legal immigrants, the state is covering the entire price tag for those who immigrated illegally. More than 13 million Californians are enrolled in Medi-Cal, about a third of the state's population. The total state share of Medi-Cal funding is about $17.7 billion. Joe Mangia, president and CEO of St. John's Well Child and Family Center in Los Angeles, said the center has about 2,500 kids who will be eligible for the expanded coverage and expects about 1,000 already have emergency Medi-Cal. He said they've been reaching out to families to tell them about the option and set up appointments starting on Monday for people to come in and enroll. Health promoters have also gone out into the community to tell people about the program, he said. Until now, St. John's has treated the kids, but now they'll get much better and expanded care. Before, if there was a special need, we'd refer to the county. Maybe they'd get seen in 6 to 9 months, he said. State officials have been working to make the transition smooth and will be watching for any implementation problems they need to address. We're delighted at this chance to expand comprehensive health coverage to reach thousands more California children. So that's the way to do it, right there. You don't become a non-human being simply because you are not legally supposed to be in a country. You still have all the same needs as anyone else. You need food, you need shelter, you need safety, you need medical care. All those things are true regardless of who you are, regardless of how you got here. They don't become untrue. It doesn't stop mattering that people need help when they need help just because their documentation is not completely up to date and stamped by all the right people and signed by all the right people and so on and so forth. Anyway, excuse me. So you have been listening to me cough my way through another episode of CU Immigration here on WRFU LP Urbana 104.5 FM.